On today's Two on Your Side Town Hall, hospitals prepare. The spread of the Delta variant has a lot of local health leaders on alert. We're going to be talking live with the CEO of one of our region's major hospital systems. Plus, an answer from the Verify team on a claim that you've probably seen out there about masks as we try to address some of the misinformation. And ready for camp. We are just hours away from the first practice that will be open to Bills fans. What you need to know before you go. Thanks for being with us on this Friday evening. By now, you've probably heard the news that Erie County has passed the CDC's new threshold for recommending masks in public indoor spaces. That is based on COVID cases per day per capita. It's an important metric, but in terms of public health, from the very beginning, we've been told that the restrictions are designed to make sure we don't overload our hospitals, that's the most important number. So we want to take a look at where we are right now. As of today, 43 Western New Yorkers are in the hospital. Now, that is not a lot compared to past surges, but after that long, steady drop that you can see there, we are now going in the wrong direction. We've more than doubled from 1 month ago and up another 16% over the past week. Those are the numbers, but what is the reality inside those COVID units? Joining us live right now is Mark Sullivan, President and CEO of Catholic Health. It is always great to have you on the show, Mark. Thanks for your time.
Nice to be back with you, Michael. Thank you.
So we mentioned the overall hospitalization numbers there, but if you look at the severe cases, people who end up in an intensive care unit, that has actually tripled in just the past 2 weeks, specifically here in Western New York. So I wonder, what are you hearing from your intensivists, your hospitalists, your nurses, and how concerned are you about this uptick?
All right, first, Michael, I'd like to thank all the healthcare heroes that are still fighting for all of us in Western New York. I think what we're seeing now is you're seeing people that the majority of the people that are coming in the hospital with COVID are unvaccinated. And I know that's true nationally. So the challenge for that is they have no immunity built up to fight COVID. So although the numbers are low, the criticality of the patients can vary depending on their age, their comorbidities, and things that we heard in the spring of 2020. So although the numbers are low, we need to be focused on how do we surge and flex if that does become the case. But right now, as you mentioned, the numbers are low. But the staff are also struggling because everyone's active in Western New York this time of year. And so we have regular hospital patients to deal with as well, which is a unique qualifier compared to when we were in lockdown. So it's a challenge, but we continue to focus on making sure we keep our staff and associates safe while they're caring for everyone.
I want to ask you about the mask guidance from the CDC that we've been covering over the past few days. Erie County is now in the substantial transmission category, and so masks are advised indoors in public places, even for vaccinated people. There has been some criticism of that and some confusion, and so today the CDC kind of put out some preliminary research that was used to justify the change. I want to show this to our viewers. CDC says the Delta variant is highly contagious, likely to be more severe, and, quote, breakthrough infections may be as transmissible as unvaccinated cases. I think that has surprised a lot of people to hear that. And because of that, CDC again advising masks even for vaccinated folks in areas where there is more community spread. What is your team telling you about the Delta variant here locally? And do you believe most of the people, getting really sick and ending up in your hospitals, you just said this, these are unvaccinated people, so we don't want to leave them with the impression that you shouldn't get vaccinated?
Right. So the way I explain it to everybody is this way, is that the vaccine was never meant to prevent you from getting COVID. It was meant to prevent you from having a fatal outcome from having COVID. So I say this to everyone as a metaphor or analogy. It's like the seatbelt in your car. It's not going to prevent you from having a car accident, but it's going to lower the chances of you having a fatal car accident. So when the CDC guidelines, what they're telling us is that this new Delta variant, which there's a Gamma variant and the Beta variant, but the Delta variant is now mutated. So it means that even if we're vaccinated, we can transmit that to unvaccinated and vaccinated individuals. So there's really nothing has changed. It's just that we believed with the history we had that the vaccine would help us from preventing the spread to some extent. But now we know it's not. So we need to mask up in accordance to what the county executive does. And I think what he said, and I think the CDC is right on. It was never meant for us to be inoculated and not get COVID. It was meant to prevent fatalities.
We still have almost 400,000 people in Erie County who are not yet fully vaccinated. The president is now encouraging businesses to require that you be immunized. Is that something that you've considered with your workforce, especially those who are on the front lines? And then generally, what do you make of where we are in our vaccination effort?
I think one of the things that I mentioned the last time we were together is that when you're in the middle of COVID, everyone was rushing to find vaccine. They were up till midnight trying to find an appointment, and it was scarce. As we move into the sunshine of Western New York and people see lower numbers, like you mentioned, Michael, for COVID, there may not be that sense of urgency to get the vaccine. So we have that issue. We also have vaccine hesitancy because some people, there may not be enough data for them to make a decision. So that is a secondary challenge. For businesses, it really depends on the business. In healthcare, we always take universal precautions. So our staff are always masked. I wear a mask in our building here. We wear masks in our healthcare setting. So I encourage everyone to have that one-on-one conversation with their physician to understand the importance of the vaccine. We can't mandate the vaccine right now in the current state we're in at Catholic Health for multiple reasons. We have bargaining agreements that we need to work close with the unions. We'd want to make sure that we're ensuring the exempt for religious purposes or other purposes. So we want to make sure we do our homework on that. But we want to make sure our associates are safe, so we provide the PPE, protective personal equipment, and we continue to focus on that. The door-to-door vaccination efforts and the one-on-one conversations with individuals that are hesitant is really where the key is now, different than mass vac sites. And that's the transition you're seeing at Erie County, the 5 counties from our vaccine hub, the outreach from doctors like Raul Vasquez and Jericho Road, trying to have conversations in those underserved areas. The one-on-one conversations is really where it's going to be.
Finally, before we run out of time, I want to ask you about the news yesterday that the state has signed off on your new hospital in Niagara County. It's going to be called Lockport Memorial Hospital, a campus of Mount St. Mary's, a community hospital for folks in that area that is underserved right now. Getting this certificate of need, I know, was a big step in the process. Wondering what comes next, when is this going to be able to open, and what should people who live in that part of Western New York know about this hospital?
Well, Michael, it was a great day. I drove to Albany to sit in the room for the vote, and it was really an energizing moment because back in January, if Catholic Health didn't step up, Eastern Niagara was going to close and 80,000 people were not going to have a hospital. So it allowed us to project forward as to see when we would be able to open a hospital, and we got our CON. And we got the vote of approval, not just from the committee, but from the Department of Health that has been by our side as we're trying to serve that community. So for us, the next steps are to ensure that we stay on track. We're looking at 2023 for the opening of the new hospital. We're still learning about the community. We're learning about their needs. We're modifying the plan a little bit to make sure we meet the needs, not just of the hospital, but all the outlying rural communities around there with prevention measures and things like that. We're in a process now, as you know, supporting Eastern Niagara. That is the hospital in their community. The residents there are very happy it's there. We need to support that hospital, make sure people have access while we're building a new hospital. So we're working with the EMT providers, the emergency medical technicians, to understand what they need at the hospital. We're working with physicians, we're working with the emergency room groups, the staff, and really bringing an innovative solution to Western New York, which we believe will be, one of a kind in New York State, and we hope other rural communities will be able to have such services when we're done working on the new hospital. We're really excited about it.
Mark Sullivan is president and CEO of Catholic Health. Obviously, the positive news there about this new hospital juxtaposed with the challenges that we're all facing right now as this pandemic continues on. Thanks for your time, and good to see you.
Great. Thank you, Michael. God bless everyone.
Thank you very much. All right, obviously a lot of talk right now is about masks, and our Verify team is looking into some of the claims out there. We've known for a long time now that masks, while not perfect, do help slow the spread of the virus. It's up to governments, employers, and others to decide whether or not they should be mandated. That's not what we're talking about here. We just want to make sure everyone is equipped with the facts. So we're tackling this question. Can masks cause other illnesses? People opposed to face coverings often make this claim, saying that they do more harm than good. Our sources are the Centers for Disease Control and Prevention, the American Lung Association, and Dr. David Geer. First, the CDC says after reviewing scientific studies that it has concluded mask wearing has no significant adverse health effects for wearers. Studies of healthy hospital workers, older adults, and adults with COPD found no change in oxygen or carbon dioxide levels while those people wore cloth or surgical masks, either during rest or physical activity. The American Lung Association is even more blunt when asked if masks cause low oxygen levels. The association said, quote, "Absolutely not. We wear masks all day long in the hospital. The masks are designed to be breathed through, and there is no evidence that low oxygen levels occur." Dr. Geer, though, did add this.
Getting an infection like a staph infection or some of the other bacterial infections of the skin is possible. It's fairly rare.
So the key is to avoid that by wearing your mask properly. pretty much following common sense, like if it gets wet or contaminated, replace it. Other recommendations is to make sure that your mask has no gap, and it is best to mask with 2 or more layers. If you have something you want verified, email us verify@wgrz.com, or you can text us to 716-849-2220.